One morning, your phone rings. It's your mother. At first, nothing seems unusual. But then you hear her voice. She's confused. Her words are slow. She sounds exhausted. She tells you she's burning up with fever, but somehow she can't stop shivering. You tell her to rest. Maybe it's the flu. Maybe she just needs sleep. A few hours later, she's unconscious in the emergency room. The doctors deliver devastating news. She has sepsis. And then they say something no family ever wants to hear. If she had gotten here sooner, her chances would have been much better. This is not a rare story. It happens every single day. Right now, someone is ignoring the warning signs of sepsis. Right now, someone believes they'll feel better tomorrow. Right now, someone's organs are beginning to fail, and they don't even realize it. And that's why today's video could save a life. Because sepsis doesn't usually give you weeks to figure things out. Sometimes it doesn't even give you a full day. Before we begin, please take a second to subscribe to the channel and turn on notifications. Every week, I share evidence-based health information designed specifically for adults over 50, helping you recognize hidden warning signs before they become life-threatening emergencies. And while you're watching, leave a comment below telling me where you're watching from and whether you've ever heard of sepsis before today. I read as many comments as possible, and I'd love to hear from you. Now let's begin. Most people think sepsis is simply another infection. That's one of the biggest and most dangerous misconceptions. Sepsis is not the infection itself. Sepsis is what happens when your body's response to an infection spirals out of control. Imagine your immune system as a home security system. When an intruder breaks into your house, the alarm activates. That's normal. That's exactly what it's supposed to do. But with sepsis, it's as if the alarm system malfunctions and starts destroying the entire house while trying to stop the burglar. Instead of protecting you, your immune system begins attacking your own organs. Blood vessels become damaged. Blood pressure drops. Oxygen can no longer reach critical organs effectively. Your kidneys suffer. Your liver suffers. Your heart struggles. Your brain struggles. And if the process continues, your body can enter septic shock, a life-threatening condition that kills hundreds of thousands of people every year. What makes sepsis so terrifying isn't just how serious it is. It's how fast it moves. You may feel sick in the morning and be fighting for your life by dinner. That's why understanding these symptoms isn't simply useful information. It could be life-saving knowledge. Before I show you the 5 early warning signs, there's something important you need to know. Certain people are much more vulnerable than others. If you're over the age of 65, your risk is significantly higher. As we age, our immune systems naturally become less effective. Infections that younger adults might overcome easily can become much more dangerous for older adults. If you have diabetes, pay close attention. A simple urinary tract infection, a small wound on your foot, or even a minor skin infection can quickly become serious. I have seen patients who thought they were dealing with a routine infection, only to discover they were already developing sepsis. If you've recently had surgery, even a minor procedure, your risk also increases. Anytime the body is opened or invaded medically, bacteria can potentially enter places they shouldn't be. Individuals receiving chemotherapy, taking steroid medications, or living with conditions that weaken the immune system must be especially vigilant. And if you have chronic kidney disease, heart disease, liver disease, or chronic lung disease, your body has less reserve to handle severe infections. Here's where many families make a mistake. They assume serious infections always look dramatic from the beginning. They expect someone to be obviously gravely ill. But sepsis often starts with symptoms that appear surprisingly ordinary. That's why it catches people off guard. The first warning sign is extreme temperature changes. Most people with sepsis develop a high fever. But here's what many people don't realize. Some people experience the exact opposite. Their body temperature drops below normal. They feel freezing cold. They shiver uncontrollably. Their hands and feet may feel icy. Imagine sitting under multiple blankets, yet still feeling cold to your bones. That can be an early warning sign. One family told me their father couldn't stop shaking. They assumed he was cold because the air conditioner was running too high. By the time they realized something more serious was happening, he was already critically ill. If someone has an infection and suddenly develops severe chills, uncontrollable shaking, unusual sweating, or significant temperature changes, do not ignore it. Your body may be trying to tell you something important. Now, before I reveal the second warning sign, I want you to remember something. One symptom by itself may not mean sepsis. But when several symptoms appear together, especially in someone with an infection, the danger increases dramatically. That's why it's so important to watch until the end of this video. Because the fifth warning sign and the final critical symptom are the ones emergency doctors fear most. The second warning sign is a racing heart and rapid breathing. Many people dismiss this symptom because they assume it's stress or anxiety. But sepsis places enormous stress on the body. Your organs aren't receiving enough oxygen. Your heart starts pumping faster. Your lungs begin working harder. You may notice your heart pounding even while sitting quietly. You may feel short of breath after doing almost nothing. Some patients describe feeling as though they've just climbed several flights of stairs, even though they've barely moved. Their breathing becomes faster and shallower. They feel restless, uncomfortable, unable to catch their breath. This is your body's attempt to compensate for a dangerous imbalance occurring internally. And here's what concerns me. Many older adults ignore this symptom because they assume it's simply part of aging. It isn't. Sudden changes in breathing or heart rate should never be dismissed, especially when an infection is present. The third warning sign may be the most frightening for families. It's sudden confusion. A person who seemed completely normal just hours earlier suddenly becomes forgetful, disoriented, or confused. They may not know where they are. They may struggle to recognize family members. They may repeat questions again and again. They may say things that don't make sense. Family members often think they're witnessing dementia. Others fear it's a stroke. But when confusion develops suddenly over hours rather than gradually over months or years, sepsis must be considered. This happens because reduced blood flow affects the brain. And in older adults, the brain is often one of the first organs to show signs that something is seriously wrong. I remember speaking with a daughter whose mother suddenly became convinced she was back in her childhood home. Earlier that same morning, she had been perfectly alert. By that evening, she was in intensive care with sepsis. The good news is that early recognition can make all the difference. That's why I want you to pay very close attention to the next warning sign because it's one of the most commonly overlooked symptoms, and it often appears before families realize how serious the situation has become. The fourth warning sign is severe pain or an overwhelming feeling that something is terribly wrong. This symptom is often difficult to describe, but patients remember it vividly. Many survivors say the same thing. They don't simply say, "I felt sick." They say, "I felt like something was seriously wrong with my body." That's a very different feeling. Some experience intense abdominal pain. Others develop chest pain. Some feel pain throughout their muscles and joints. And many describe a crushing sense of discomfort unlike anything they've ever experienced before. As sepsis spreads through the body, inflammation increases dramatically. Organs begin struggling. Tissues become damaged. Your body enters a state of emergency. Here's what worries me. Many people try to push through the pain. They tell themselves they'll feel better tomorrow. They don't want to bother their doctor. They don't want to overreact. But when severe pain appears alongside infection symptoms, it's never something you should ignore. Your body may be sending a distress signal. The fifth warning sign is one that many people miss completely. Skin changes. Your skin can reveal a surprising amount about what's happening inside your body. When sepsis develops, blood flow begins changing. The body tries to protect vital organs by redirecting circulation. As a result, your skin may start showing visible warning signs. Look for red or purple spots that don't fade when pressed. Look for skin that feels cold and clammy. You may notice blotchy patches with areas that appear unusually pale alongside darker discoloration. Some people develop a mottled appearance on their arms or legs. In severe cases, fingers and toes may even begin turning blue due to reduced oxygen delivery. This is not normal aging. This is not something to monitor for a few days. These changes demand immediate medical attention. Now we've reached the symptom that emergency doctors fear most. The symptom that often signals time is running out. A sudden drop in blood pressure. This is where sepsis becomes especially dangerous. As blood pressure falls, vital organs no longer receive the blood and oxygen they need to survive. The kidneys begin shutting down. The liver struggles. The brain becomes deprived of oxygen. Patients may suddenly feel dizzy, lightheaded. They may have difficulty standing. They may feel as though they're about to faint. Some people lose consciousness entirely. This condition is known as septic shock. And once septic shock develops, the risk of death rises dramatically. Let me be very clear. If someone has signs of infection and suddenly becomes confused, dizzy, extremely weak, collapses, or loses consciousness, treat it as a medical emergency. Do not wait until morning. Do not search the internet for hours. Do not hope it will improve on its own. Call emergency services immediately. Every minute matters. Research consistently shows that early treatment dramatically improves survival. The faster doctors can begin treatment, the better the chances of saving organs and saving lives. So what should you do if you suspect sepsis? First, trust your instincts. If something feels seriously wrong, pay attention. Many families later say they had a feeling something wasn't right but talked themselves out of seeking help. Second, seek medical care immediately. Don't wait for symptoms to worsen. Don't assume it's just the flu. Don't assume it's only a minor infection. Third, tell healthcare professionals exactly what concerns you. Use the word sepsis. That single word can help healthcare teams act more quickly. Hospitals have specialized protocols designed to identify and treat sepsis as rapidly as possible. Doctors may order blood tests, monitor oxygen levels, measure blood pressure, and evaluate organ function. If sepsis is confirmed, treatment often begins immediately. Patients typically receive intravenous antibiotics to fight infection, intravenous fluids to support blood pressure, oxygen therapy when necessary, and sometimes medications that help maintain circulation. In severe cases, intensive care may be required. The goal is simple. Stop the infection. Protect the organs. Save the patient's life. The good news is that many cases of sepsis can be prevented. The first step is preventing infections whenever possible. Wash your hands regularly. Stay current with recommended vaccinations. Keep cuts and wounds clean and protected. Manage chronic conditions carefully, especially diabetes. The second step is treating infections early. Don't ignore urinary tract infections. Don't ignore pneumonia symptoms. Don't ignore infected wounds or dental infections. Small problems can become dangerous when left untreated. The third step is learning your body's normal patterns. If something feels different, pay attention. If you suddenly develop chills, unusual weakness, confusion, rapid breathing, or severe pain, listen to what your body is telling you. One of the biggest mistakes I see is older adults assuming every symptom is simply part of aging. It isn't. Your body gives warning signs for a reason. The key is recognizing them before it's too late. Today you've learned the 5 early warning signs of sepsis. Extreme temperature changes, a racing heart and rapid breathing, sudden confusion, severe pain or extreme discomfort, and skin changes. You've also learned the most dangerous symptom of all, a sudden drop in blood pressure leading to dizziness, collapse, or loss of consciousness. Please remember this. Sepsis moves fast, but early recognition saves lives. Thousands of people survive every year because someone noticed the warning signs and acted quickly. That someone could be you. And before you leave, I want you to do something important. If you've watched this far, type sepsis aware in the comments below. That tells me you're committed to remembering these warning signs. And it helps more people discover this information. If you know someone over the age of 60, share this video with them today. A parent, a spouse, a sibling, a friend. You never know whose life could be protected by this knowledge. If this video helped you, please click the like button and subscribe to the channel. Every week, I share trusted health information designed to help adults over 50 stay healthy, independent, and informed. Thank you for spending these minutes with me. Thank you for caring about your health and the health of those you love. Take care of yourself. Stay alert to the warning signs. And remember, when it comes to sepsis, every hour matters. I'll see you in the next video.